Tell me, what do you see? How will you analyze this case?
Characteristic symptoms are of cough. So patient was telling that the mucus is thread-like, ball-like. So
That is one symptom
that
you
is
would
the
like.
most bothersome symptom for the patient.
Huh.
Another, he was the general weakness due to the cough.
Huh.
So weakness is also a characteristic symptom, the second characteristic symptom. And according to the cause and effect, we can say that the cause was the grief due to the death of the mother.
Hmm.
So
So you will take.
ailments from grief,
Hmm.
characteristic symptoms of the cough,
Hmm.
of expectoration,
Hmm.
and the general weakness due to the cough, the effect.
Correct. So I think you have also done a repertorisation on these symptoms. No, what rubrics have you taken?
The mind ailments from grief,
Hmm.
the mind ailments from grief, mind cough morning rising after, cough weakness in cough weakness from
Hmm.
expectoration ball like in shape.
There was, along with thread, there was also ball like.
Ball-likes.
Correct.
आणि general weakness, and one more, mind indifference.
Indifference. Why?
The patient said lack of interest in everything, so indifference to.
When patient says, I have lost interest in life, then you take the rubric indifference. Hmm.
So first four remedies are arsenic, sepia, phosphorus and sulfur, and fifth remedy is China.
Hmm. Good. Okay. So now, what is important is that you always look for the cause first. Okay. And like you're saying, it seems the grief is a direct cause that we see in this case. Right? Now, the only issue is that along with cause, if you want to characterize, then you should combine the cause and effect. Okay? And the effect of the grief on this patient is indifference. Because of mother not being there, I feel that she's not there to support me. I feel she's not there to comfort me. And I'm not interested. I have lost interest in life in general. These are her words out of the grief. So grief is the cause, and the effect is her feelings that there is no support, that she is no more there to talk, and that I have lost interest. So what you should take is, first, that patient needs support. So you should look for rubric like grief with support desires. Get this? Or you look for grief with company desire for. Or you look for grief with indifference. Okay? Grief with indifference. So now, support desire as a rubric, as a sub rubric of grief, you don't get. So what I do is, I keep support is important, but I keep it at the back of my mind. Then the second thing is company desire. Okay, that I can take grief with company desire if it is there. If not, what I will do is, I will take ailments from grief in general, and I will take in general company desire. Ideally, I want a rubric grief with company desire. Within the grief rubric, if you get a sub rubric, like company desire, that is very good. If you don't, then you split. Then you say grief, and then you say company desire. Then third rubric you want is grief with indifference. correct? So do you get a sub rubric like that, grief with indifference? That's ideal. If you don't get, then you split, you keep grief as it is, and then you say indifference. Get this? Now when you do like this, when you do like this, then you will see that you are covering the main mental picture. You're not picking only one rubric. You're not saying grief with indifference only, or grief with company only, grief with support only. All three are important. Get this? All three are important, and you should be open that not everything will be covered either by repertory or by Materia Medica or with the latest advances like sensation idea. That you should not think that support means okay, now I have to think of column 2 remedies only. There are many remedies which require support and which are not there in column 2 or 1 of the periodic table. Okay, there are many other remedies, even row 2 remedies require, even actually right side, even arsenic has rubric like held desire to be, plumbum has rubric, they are in the right side of periodic table. So, and there are many animals and plants also who can talk like this. Okay, so just don't hang on to that particular word, but because that word has come, it is important, it should be there at the back of your mind. And always first establish yourself on the symptoms of the patient, and then start using the kingdom, miasm or superclass idea. Okay, so first thing is I am looking for grief and its characteristic, grief with company, grief with indifference. Then I see the general physical effect. General physical effect is patient is feeling I am becoming very weak. Weakness is a general symptom. It's not belonging to only one part of the body. There is a generalized tiredness, tired feeling, and it is there along with cough. It is also there along with bleeding. Patient is saying I am having profuse menses, I got weak, I am having again the spotting has began, I am becoming even more weak. So you see respiratory complaint and the menstrual complaint, both complaints are giving you the same physical symptom, that is weakness. Therefore it's a general pattern. And also weakness itself is seen all over the body. So these three reasons tell me that this is the physical general, that is weakness, exhaustion causing tiredness. And that tiredness is caused by the cough itself. That tiredness is also caused by bleeding. Okay, now I will take the local characteristics, like what? Cough with thread like expectoration, cough with transparent expectoration,
Profuse.
cough with expectoration profuse, transparent, profuse, ball like, thread like. These are the character, or cough with morning aggravation. All this will come later, but first in homeopathy we are always looking for the general first. So what are the generals? The general is the mental grief, the general is the weakness, and then the local characteristic. So if you see this much grief with indifference, the first remedy that comes to my mind is phosphoric acid. Okay, grief is with indifference, and then I see acids generally have weakness. And however, even if you look at the mental symptoms, in general company desires is phosphorus, right? Then you have support desires, acids are column row 2 of periodic table, so they will require support. Okay, and then if I see the general pattern of weakness, in general weakness began because of profuse blood loss, which is again what? Phosphorus. Phosphorus has hemorrhagic tendency, phosphorus has bleeding, correct? And then phosphoric acid is known for weakness, cough exhausting. If you see this rubric, there is phosphoric acid. Hmm? And weakness of lungs in general, which patient says, no, this is causing weakness of lungs. Lung affinity, weak lungs is very important symptom of phosphorus. Okay, now because the general pattern is already covered by phosphorus, now I look if the local symptoms are being covered, and it's okay. So for example, if I see the rubric cough, expectoration, thread like, there is neither phosphorus, there is neither phosphoric acid. There are only 3-4 remedies. I don't remember what remedies are there, but no phosphorus, no phosphoric acid. Ball like or transparent. Phosphorus may be there, phosphoric acid is not there. Okay, but I am not worried that that is not covered. But profuse expectoration, that is again covered by phosphoric acid. So one or two symptoms are covered, one or two symptoms are not covered, which belong to the local uh, symptoms of the patient. But I am not worried because the general pattern is better.
But sir, patient's main symptom or the bothersome symptom is cough. So if the medicine covers the general pattern, then if we give phosphoric acid, then does the symptoms will reduce.
So, but the patient's most bothersome symptom is cough, and your remedy does not seem to have the characteristics of cough, but it has the main causative factor of cough.
Okay.
It covers the grief, it covers the general symptom of weakness. So, if the cause is being removed, then it does not necessarily mean the local characteristics have to be covered.
But in acute cases, patient wants the relief. Then how can
that he will get? That even in acute complaints, even if patient wants quick relief, you have to match the cause and its general effects and then its local effects. So phosphoric acid is not covering thread like expectoration, but it is covering profuse,
ball like.
it is covering ball like. Then just because one symptom does not is not covered by the remedy, you cannot ignore the whole general pattern that is being covered.
Okay.
So what should happen ideally is, see, during follow-up, suppose this patient comes and she tells you that, doctor, what remedy you gave, my cough is 20-30% better after 2 days 3 days. If she says my cough is only 20% better, I'm okay. Okay, I'm not so worried, because I will first ask how is your grief, how is your weakness. So then if patient says, that mother, I am not missing as much, or this weakness is reducing, or my blood spotting has reduced, then I know that the general pattern of weakness, cough, weakness, grief is reducing. So the cough will reduce. It has started only 20%, but it will reduce. But if the reverse is seen, that is, cough is 70% better and there is no change in grief, there is no change in weakness, I'm feeling as weak, but the cough is better, then it's not a good reaction. In homeopathy, you are always looking for the general pattern. The general pattern should reduce. The general pattern is weakness. The general pattern is grief. That should reduce. That is important. That overall sense of well-being should come. कि हाँ अभी weakness नहीं हो रहा है, अभी थोड़ा interest now I am feeling interested, now I am getting interest in thing. Now I am not thinking so much of mother. Now I feel like eating food. Now I feel like talking to people. Now I feel like going out, doing some work. I'm not feeling so weak. I'm feeling energetic. But the cough is only slightly better, doctor. Don't worry. Give it 3 4 days, cough will also disappear. That's what has to happen. There has to be general well being of the patient along with local symptoms improving. So, even if it is 10 20% relief, no, patients from experience, what I can tell you is patients are happy if it's the right remedy, no, don't they know. So this worry that sometimes we have, no, अरे खांसी नहीं कम करेंगे, if I don't reduce the cough, patient will go. Patient को relief, if patient does not have relief, how will he stick? But if it's the right remedy and if the general state improves, no, patients come to know. Patients know immediately that this is the right thing happening to them and they will stick. Don't worry. Remedy gives enough insight to the patient to know that this is right remedy.
Okay.
Patient will tell you. He will himself tell, रुक जाओ, कोई ज़रूरत नहीं, हो जाएगा कम. बहुत lot of time these patients will tell कि डॉक्टर I didn't call you after 2 days because I was feeling और 2 दिन देना चाहिए दवा को, it will reduce. This confidence patient gives you. So overcome this insecurity or this fear that, oh, if I don't address the local symptom, then cough, or then patient will bounce, patient will not stay with me, he will look for acute remedies, he may take antibiotic or he may find some other doctor. No, if it's the right remedy, immediately patient comes to know and patient will stick, patient will not run away, 100%.
Okay. Sir, one more question. Sir, by taking the general rubrics, as you said, stick to the general patterns. By taking the general rubrics, the number of remedies are increasing as I take the general rubrics. In, as you said, take general weakness. In general weakness, there are more than 100 to 120 remedies from A to Z, all remedies. Now you said the remedy is phosphoric acid, but my first 5 remedies there is no phosphoric acid. It's 12th on the at a 12 number on remedy repertorial chart. So how can I understand that phosphoric acid by repertorizing? How can I take the rubrics?
What are the remedies? The first 5 remedies?
Arsenic, sepia, phosphorus, sulfur, and China.
Okay, so what are the rubrics you have taken?
Mind ailments from grief, mind indifference, cough, morning rising after aggravation.
So firstly, before you go ahead, firstly, I would like to see the rubrics that you take also in the same sequence as we evaluate. So we said grief is the cause, okay? The effect of the grief is what?
Indifference,
In-
lack of interest.
That is one symptom. There were 3 symptoms. First is support. Did you search for support?
No.
No. So you should search. Okay. Second was what?
Indifference.
Company.
Company.
Company desire. Have you taken that?
No.
Third rubric is indifference.
Okay.
You know. So this search also for grief with company, grief with indifference is also important, or grief with support.
Okay.
You have removed company, correct? And indifference you have taken, no? Indifference you have taken. So that you should do. Company I would like to add. Okay. This is first. Then second important symptoms we said were generalized weakness. And then you have to also characterize the weakness. So weakness from loss of blood, or weakness from cough exhausting. You know, there were 2 reasons for the weakness: weakness from loss of blood, weakness from cough exhausting. And then you take expectoration, profuse, thread-like, ball-like, etc., etc.
Okay.
If you take it like this, I'm sure if not phosphorus, if not phosphoric acid, at least phosphorus will come. And I think even in this repertory sheet, phosphorus has come up, no? In the first 5, it's the which second remedy or third?
Third.
Third remedy is phosphorus. Okay. So, see, repertory's main goal is to give you a group of remedies. It is not always there to tell you this is the remedy.
Okay.
It is always there to give you group of remedies. So always look for the first 5, 7, 8 remedies, or even 10 remedies that come up in your repertorial rubric, which are covering majority of the symptoms. Within that 10, you have to now see which remedies out of these are especially known for grief and company and indifference, because that's your most topmost important symptom. So for example, first remedy is arsenic.
Arsenic.
So arsenic you don't associate as this is the remedy for grief. Arsenic you associate more that it is a remedy for anxiety, insecurity, all that. So that's why arsenic I will not think. Second remedy is what? Sepia. Now sepia is interesting. Sepia also has indifference. Correct? But then you have to see the cause of the indifference in sepia. In sepia, the cause of indifference is because someone dominated them and did not allow them to do what they like. I wanted to become engineer, but my father said girls should become doctor only. He forced me, and I had to do. I had to become a doctor. Okay, whatever, I wanted to become artist, whatever, or I wanted to wear this kind of dress, and they really were very strict and very conservative family, so they suppressed all my desires, all my passion. So in sepia, the main thing is my passion is suppressed, my desire is suppressed. So now I have no desire left, because you suppressed my main desire so much that now I have no desire, now I have no interest in anything. This patient, nobody has forced her. This patient's grief is only out of losing a loved one. No? So love is important, loved one is important. So the third remedy is what? Phosphorus. So phosphorus has to do with love, affection, loved ones. In fact, for grief, the top 3 remedies that you should always think of is nitrum mur, ignitia, and phosphoric acid. These are the 3 main remedies that you should think of first. And within that, if you see lack of interest, disinterest in life after the grief, the first remedy to think of is phosphoric acid. So even though in the repertorial rubric you see phosphorus, but because of Materia Medica knowledge, I will give her phosphoric acid. Because see, phosphorus also has indifference. If you read phosphorus Materia Medica, it is written that it has indifference. But the main remedy for grief with indifference is phosphoric acid rather than only phosphorus. That's why I will go with phosphoric acid.
आइडियल में क्या होना चाहिए कि हाउ टू रेपर्टराइज, हाउ टू टेक रूब्रिक, जो आपने मुझे बताया कि जनरल भी लो और उसका सब रूब्रिक भी लो.
हाँ. So ideally, once you
so you said to take general as
rubric
a weakness, and then also take general weakness cough from, or mind indifference general rubric, and mind indifference everything two rubrics, general and
local. See, first, before repertorizing, always have your analysis very clear. What are your general symptoms? What are your mental symptoms? What are your local symptoms? Like Kent has said.
Yes.
So, once you have this written in this sequence also is very important. Okay. Then, suppose you have grief with what? Company desire. So, ideally what you should do is you should first start with general rubric, that is ailments from grief. Don't take directly grief with company desire, grief with its sub rubric. Always take general rubric, that is grief, ailments from, and then add another rubric, grief with company desire or grief with indifference. Sometimes you may get indifference within the sub rubric, or sometimes you may not get. The best thing is you get the combination, that is grief with indifference or grief with indifference, a company. This combination, if you get, that is characteristic. If you don't, only then split. Then take grief in general, then take company in general, then take indifference in general. Get this?
Okay.
Materia Medica is what? All three together. That is grief, causing indifference, and company desire for.
Ah.
This combination is Materia Medica. But in repertory, it's all split. How much you can combine all these three into one rubric, it's the best thing. You are getting a keynote then. If you are not getting this three combination, then you split all three. Then you say grief general rubric, then you say indifference general rubric, then you say company desire in general rubric. But ideally you want to combine all these three into one. If you can combine all these three into one, you have got a keynote rubric, and the remedy that will cover that particular rubric has high chances of being the remedy. So that's why sometimes you get this, and sometimes you can prescribe based on single rubrics also, but majority times you don't get it. So majority times you are splitting symptoms into three parts or two parts. So when I say take general, I mean take general rubrics of grief, general rubric of indifference, and general rubric of company desire, and then take sub rubrics of each. Within grief, can you get something like indifference or company, or within company desire, can you get something that was relevant, or within indifference? So there were, I think, in the indifference, the sub rubric, you get one sub rubric that is indifference everything too. That one sub rubric you can add, but ideally you want to combine all these three. And the same thing you do with weakness also. Weakness in general rubric, and then you see weakness from blood loss, and then you see weakness from cough exhausting. So this combination is characteristic. I hope this session is useful to you and you understand how to take cases, analyze cases, select rubrics, conversion of rubrics, and final selection of remedy. That is what I wanted to share from this video. I hope I have achieved that. See you soon in our next video. Till then, bye bye.